I really appreciate being invited here. It's not that far away, 5 hours. Anyway, I'm going to try and answer the question of whether or not Sarnia water fluoridation is safe or unsafe, effective or not. Here are my qualifications. I have a BSc and PhD in biochemistry, and I studied dental tissues for my PhD. I have a dental degree, been practicing since '83. I was head of preventive dentistry at University of Toronto and full professor. I retired in 2012. I've done decades of funded research on teeth, bones, and the effects of fluoride. And I was the only Canadian member on the 2006 U.S. National Academies of Science Subcommittee on Fluoride in Drinking Water. So Dr. Runaday did talk about systematic reviews and the meta-analyses of randomized controlled trials. Now, the randomized controlled trials are the trials that you use for drug approval in Health Canada. Way down at the bottom is expert opinion in terms of evidence to support effectiveness. Now, what happens with dental decay worldwide, it has declined. And not just fluoridation, but a whole bunch of other factors have been involved in lowering dental decay worldwide, including fluoridated toothpaste. It turns out you have to fluoridate for about 40 years to save one tooth from decay. So the 25% decline represents basically one filling per person over 40 years. Now, Dr. Runaday did talk about the Cochrane Reviews, and the most recent one reiterated that there were no RCTs, no randomized controlled trials. Only 3 studies were done after 1975, which is when toothpaste was in wide use. So that means the toothpaste basically competed with water fluoridation. None of the studies took into consideration all of the factors that lowered dental decay. Now, the dental hygienists have been quoted as saying that Calgary is an example of what happens when you stop water fluoridation, that you see an increase in dental decay. But in Calgary, they actually did not do that. In Calgary, there was an increase in dental decay, and even though they stopped fluoridation in 2011, it made no difference in terms of the dental decay. A neighbor, Windsor, stopped fluoridation in 2013. You can even see that the dental decay dropped after they stopped water fluoridation. So here's the comparison of the reviews that Dr. Runaday talked about, and what he even used the word overwhelming evidence. This is what the profession says: overwhelming evidence of benefit. In fact, there is very limited quality research to support that. They say it benefits it's an equitable service. It benefits the poor. In fact, there's E level of evidence for that. There's really no evidence for it. They say it's safe. And the reviews, the York Review, the Cochrane Reviews, basically say the level is about a C level evidence. It's weak evidence for safety. They say it benefits adults. There are no studies to show that. What level should you be fluoridating at? Well, it turns out the most recent research shows the level should be maybe around 0.35 parts per million, mostly because of all the other sources of fluoride. You're at about 0.6, 0.7, which is not that much more beneficial than 0.35. In fact, there's an overlap with the toxic range. The toxic level where you start to get fluorosis is 1.5. Therapeutic range overlaps that. Why does it overlap? It's because some people take in more fluoride than others. Athletes, outdoor laborers, People with kidney failure that are on hemodialysis, they're having major problems with clearing out the fluoride from their system, even when they drink normal levels of fluoridated water. And the worst case is babies on infant formula. They're getting adult doses. So if you take a baby on infant formula and you add tap water, or even the nursery water that you can get at Walmart, you're ending up giving this baby a dose that is 400% higher than what's recommended by the Canadian Dental Association to prevent dental fluorosis. This is a direct quote from the Cochrane Reviews. Where the fluoride level in water is 0.7 parts per million, there's a chance of around 12%, or 1 in every 8 kid, of people having dental fluorosis that may cause concern about how their teeth look. So they're worried about the way they look. This is what you see in Canada. 1 in every 10th kid has some form of fluorosis. Some of it is severe and needs to be treated. And it gets worse. So Dr. Runaday talked about one study that was done, never published, and said it was too low to report. In actual fact, there are lots of studies to report how serious it is in Canada, in the fluoridated cities. It gets worse with age. You can imagine a 16-year-old wanting to have the teeth finally treated because of the fluorosis. The largest study in the States has shown that it actually increases. It has been increasing over the years. It's getting worse and worse. And the most recent study, called the NHANES study, has shown that it's even worse than what is shown in this graph. So what do dentists do? I've treated numerous cases like this. The objectionable fluorosis that's mild can be microabraded, or just shave off the surface of the enamel, and then you have to bleach. It can cost up to $2,000. Sometimes you put composite veneers over top of the fluorosis. In some cases, dentists even put porcelain veneers, and each case can be up to $20,000 if you cover all the teeth with porcelain veneers. So I'm starting to look at the cost of what it might cost the families in Sarnia. Laws basically has about 20,000 kids serviced by their water supply. About 1 in 10, or 2,000 kids, will be seeking some treatment, or will want to have some treatment for their fluorosis. So maybe if 1,000 have microabrasion and bleaching, and 900 have cosmetic fillings, and only 100 have porcelain veneers. So only 10%, or 100 out of the 2,000 end up with porcelain veneers. That's a huge amount of money that they have to spend to treat the fluorosis. I estimated about $4.3 million. How much is it costing you to fluoridate? This is a direct quote from the Lambton Health. It's $1.26 per resident per year. You have to fluoridate for 40 years. You also spent this money on a new fluoride system, which was financed, and that has to be replaced in about 20 years. So it's costing about $1 million for this new fluoride system. And you don't even consider all of these other factors in terms of the cost of fluoridation. There's a whole number of other indirect costs related to fluoridation. So the cost for fluoridation, according to that $1.26 per person per year, would be about $5 million after 40 years. New equipment, $1 million. Cost to repair the fluorosis, as I estimated, $4.3 million. A total of $10 million the next 40 years. And you're saying you're going to save a filling per person over the next 40 years. 100,000 people in the Lambton area saving one filling per person, that's $10 million. There's no cost savings, none whatsoever. It's a wash. What happens when you swallow the fluoride? It goes in your stomach, immediately goes into the bloodstream. Most of it gets accumulated in the teeth and bones. You can't excrete it in the breast milk, sweat, or saliva. The rest gets excreted in the kidneys and peed out. Once it gets in your cells, it's like a bomb goes off. It's really quite harmful. We did a study showing that the people in Toronto who fluoridated had much higher levels of fluoride in their bone compared to Montreal, was never fluoridated. So if they started fluoridation in Sarnia in, 63? I couldn't find the number or the year that you started, but most of you in this room have had a lifetime of fluoride accumulation. You've got fluoride in your bone because of fluoridation. And we showed that the strength of the bone was lower in the more fluoridated group. You're making your bones more brittle. Not only that, but because the fluoride accumulates in the bone, you're now also exposing the immune system to possible harm, causing immune system changes. This is a Scientific American article, and here's a quote: may induce malignant tumors. Based on this particular study, that there was a 5-fold increased risk of bone cancer in boys because of water fluoridation. And then there's a fluoride effect on IQ, or brain chemistry. There are over 100 animal studies where fluoride alters the brain chemistry and physiology. 34 out of the 36 animal studies have shown a reduced ability to learn. In 51 out of 58 human studies, fluoride lowers IQ. So you get dental fluorosis in 1 in every 10 kids, and that dental fluorosis is associated with a change in IQ. Here's the fluorosis rates. As you get higher fluoride exposure, you have a lower IQ. This has been documented in systematic reviews by a Harvard professor and his graduate student, Anna Choi. Now, Dr. Ranade has said that it's perfectly safe if regulated properly, but you cannot regulate it in these people. They get too much of it. We don't have any studies at all to show that athletes are okay, that outdoor laborers are okay by drinking 6 liters a day, that people with kidney problems are okay, and especially infants whose minds are developing. We don't know if they're okay. So my conclusion, it's my opinion based on the research that we did and all the research we did, National Academy of Science, that it can cause bodily harm, that it does not provide the dental benefits as claimed, and is not cost effective at all. Thank you.
Thank you.